Connecticut's Back to School Authority is sponsored by Yale New Haven Children's Hospital, one of the best in the nation.
School nurses already carry a large load, but this year they'll have more responsibilities because of COVID-19. Channel 3 Eyewitness News reporter Sharon Johnson explores the critical role nurses have this year and the challenges that come along with it.
So a typical school nurse day is busy, depending on the level. There are kids in and out all day, and the little ones, it's for Band-Aids and boo-boos, and as they get older, it's for a number of other reasons.
School nurses are always occupied. They work with sick children, file paperwork, and assist students who need daily medication. This year, they'll have to do all of that and much more.
But we've added a lot more to their plate.
In Colchester and Plainville public school districts, nurses have already taken the lead with creating COVID-19 education for staff and families. They'll also be training staff and students on using PPE, properly sanitizing, and adopting basic health precautions. And once classes are in session...
But essentially, nurses will have to work quickly this year to triage sick students who come to the health office that may have COVID-19 symptoms.
In Colchester, teachers will call ahead to the nurse's office and assess the students' symptoms before they're taken to an isolated area.
We want to make sure they follow up with their doctor and get guidance on the need for testing or isolation, especially if they have COVID-19 symptoms.
Simard says they'll spend more time following up with families of students who have gone home sick or are absent. They'll also assist their local Department of Health with contact tracing if anyone gets COVID-19. And of course, nurses may need some additional assistance.
We need additional partners in the school to help with the anticipated increase in mental and behavioral health needs.
The National Association of School Nurses has called for billions of dollars in funding for proper PPE, sanitation, and the hiring of more nurses. With many school districts requiring an isolated room for students with COVID symptoms, the NASN says schools need additional staff to supervise those kids.
And you need an additional person to staff that room, and then to manage all of the well children who are coming to the clinic to meet their daily needs.
Combs says parents can be a great help to nurses this year by simply keeping sick students at home.
We need for parents to be our partners, and if their children are symptomatic, to keep them home and to speak with their healthcare provider about that.
Despite their additional tasks, nurses say their main job this year hasn't changed, and that's keeping students healthy and safe.
So all of that will remain the same.
Sharon Johnson, Channel 3 Eyewitness News.